Good morning, everyone, and I wish to welcome the officials of the Ministry of Health, the Ministry of Finance, the Ministry of National Security, the Airports Authority of Trinidad and Tobago, and the Port Authority of Trinidad and Tobago on this continuation of the inquiry into the preparedness of the public authorities for the potential spread of COVID-19 in Trinidad and Tobago. My name is Bridget Anizet George, and I'm the chairman of the Public Administration and Appropriations Committee of the Parliament of Trinidad and Tobago. The Committee on Public Administration and Appropriations has the mandate to consider and report to the House on A, the budgetary expenditure of government agencies to ensure that expenditure is embarked upon in accordance with parliamentary approval. B, the budgetary expenditure of government agencies as it occurs and keeps the Parliament informed of how the budget allocation is being implemented. And C, the administration of government agencies to determine hindrances to their efficiency and to make recommendations to the government for improvement of public administration. The purpose of this meeting is to continue the inquiry into the preparedness of public authorities for the potential spread of COVID-19 in Trinidad and Tobago. The committee is desirous of receiving updates from the relevant stakeholders about plans in place to treat with this global epidemic. The committee is also seeking to determine the challenges being faced by the stakeholders in light of the rapid ongoing developments and to identify some of the solutions to these challenges. This meeting is being held in public and is being broadcast live on the Parliament's Channel 11 and Radio 105.5 FM and the Parliament's YouTube channel, ParlView. Viewers and listeners can send their comments related to today's inquiry via email to parl101@ttparliament.org, Facebook /TTParliament, and Twitter @TTParliament. I will therefore now invite the representatives of the various agencies to introduce themselves and thereafter the members of the committee. And maybe we could start with the Ministry of Health.
Thank you. Morning, Madam Chair, members of the committee. Asif Ali, Permanent Secretary, Ministry of Health.
Good morning, Chair and members. Dr. Roshan Parasram, Chief Medical Officer, Trinidad and Tobago.
Can move now to the Ministry of Finance.
Morning, Chair and members. My name is Savitri Sipasad, Deputy Permanent Secretary, Ministry of Finance.
Good morning, Chair, members. I am Yvonne Imacharan, Deputy Permanent Secretary, Ministry of Finance.
Good morning. I am Syed Khan, Assistant Comptroller, Customs and Excise. Good morning.
Good morning, Chair, members. I am Leslie Hewitt, Collector, PRCO, and Air Services, Customs and Excise.
Thank you, and then maybe we could go on to the Ministry of National Security.
Good morning, Madam Chairman. Vel Lewis, Permanent Secretary of the Ministry of National Security.
Good morning, Chair and members. I am Major General Retired Rodney Smart, CEO of the ODPM.
Good morning, Chair and members. I am Air Commodore Darrell Daniel, the Chief of Defense Staff.
Okay, and do we have representation from the Port Authority of Trinidad and Tobago?
Morning, Chair, members. Trudy Conlon, CEO, Port Authority of Trinidad and Tobago.
Morning, Chair, members of committee. Dr. Sonia Rhodes, Port Medical Superintendent.
Good morning, Chair and members. Ms. Joy Guy Brown, Occupational Health, Port Authority of Trinidad and Tobago.
Thank you, and the Airports Authority of Trinidad and Tobago.
Morning, Chair. My name is Hayden Newton. I'm the General Manager of the Airports Authority of Trinidad and Tobago.
Good morning, Chair and members. Albert Griffith, Deputy General Manager, Security, Airports Authority of Trinidad and Tobago.
Morning, Chair, members. My name is Kurt Menal, Deputy General Manager, Acting Operations, PRCO International.
Okay, so please excuse that technology glitch. All right, so can I now ask the members of the committee to introduce themselves, and I will start on my right.
Good morning, Lakram Bodo, Deputy Chairman of this committee.
Good morning, Amrita Deonarai, member.
And the committee today is ably assisted by its Assistant Secretary, Sharon Samuel, Research Assistant, Rachel Noons, and also the Graduate Research Assistant, Mr. Justin Jarrett. And maybe we could begin with the Chief Medical Officer, just putting into context the developments since we were last year on the 5th of February, 2020.
So let me start with the World Health Organization's Situation Report number 50, which is dated 10th of March 2020. I think last time we were here, there would have been 22 countries, which was been maybe just over a month ago, affected. To date, WHO has said that we are now up to 109 countries or territories, 5 new territories being added to their list as of yesterday within the last 24 hours. So globally, when we look at the numbers again, 113,702 confirmed cases globally, with 4,012 deaths. Within China, there's 80,924 confirmed cases, only 20 new within the last 24 hours, which is a great improvement in terms of China. There are 3,140 deaths, only 17 new within the last 24 hours in China. Outside of China, we have 32,000 cases, 778, with 4,105 being new within 24 hours, 872 deaths, again 186 new. And as I said before, 109 territories throughout the world have been affected thus far. WHO's risk assessment remains for China very high, regional and global level very high, and global level very high. In terms of Trinidad and Tobago, we have no confirmed cases per date. Based on our last figures, we would have tested 40 persons. Thus far, we had no positives in Trinidad and Tobago.
Thank you, Siamud. The last time we were here, I think we would have had, I think about 5 countries with travel restrictions. Could you update us with respect to countries which were added since then?
Right. So I think prior we would have had 6 countries, including 5 additional countries plus China. So it would have been 6. Yesterday there would have been an announcement from the Prime Minister which indicated the addition of 3 additional territories, Spain, France, and Germany. So now we have a total of 9 countries that are restricted in terms of travel to Trinidad and Tobago for non-nationals. And immigration is the agency that will assist us in getting those persons back to their countries, their last port of call, in the event that they do come to Trinidad.
So I know we would have discussed this before, and a lot has been done to sensitize the public, but I think it is worth us reminding the public how these travel restrictions work for countries which have been identified.
So for the 9 countries that have been identified thus far, if any non-national is trying to come to Trinidad, having visited any of the countries or lived in any of the countries within a 14-day period, they will not be allowed entry into Trinidad and will be, based on the Immigration Act, I think will be returned to the last port of call, last port before Trinidad. If a national is returning, the national will be placed on home quarantine in the first instance, or will be assessed by the public health officer to determine whether they are fit for home quarantine or they need to be isolated at a hospital.
Thank you very much. And maybe I could ask immigration in terms of between the date of our last hearing and now, if there have been any non-nationals who have tried to come in from restricted countries who have been returned in terms of numbers, and the last time that would have happened.
Good morning again, Madam Chair and Chair members. To date, we had 10 non-nationals who have been refused entry based on information received from the Port Health and the medical authorities. 10 nationals, which include a Finnish national, an American national, Chinese national, Jamaican, Japanese, Italian. And the last refusal was done on the 3rd of March.
Thank you very much. I'll now invite Dr. Bodo to ask any questions if you may wish.
Thank you, Madam Chair. Again, welcome to all. Good to see you, CEO. I know you must be probably under a lot of pressure and stress and so on, but seem to be handling yourself well. I just wanted to follow up on the travel restrictions that was spoken about earlier, and to ask whether these travel restrictions have been communicated to airlines at ports of embarkation, for example. Wherever flights are leaving to come to Trinidad, the point being that it might be better to have these persons not board the flight at all, rather than arrive here and have to be sent back.
Right, so based on the number of restricted countries we have, the number 10 seems low. And I think it is low because we have communicated with the airlines through IATA. So they have a local agent who we have been in communication with to get the word out to the airlines. Of course, the Airports Authority as well, and Civil Aviation plays a role, but the airlines agent, through IATA's agent, has been communicating with the airlines to let them know which countries are restricted, so they're not being allowed to board at the port before Trinidad and Tobago.
So that is happening?
That is happening, yeah.
Yeah, I just wanted to take you to a recent report, I believe as early as last night, regarding a new case in the province of Alberta in Canada, and the report stating that the person had been to Trinidad prior to returning to Alberta. Can you communicate some further information?
So we would have learned of the chief medical officer of that area communicating in a press conference, I believe, that 7 persons, taking their number up to 14, would have contracted COVID-19. They had indicated one of those persons or has been to Trinidad and Tobago within the recent past. No other information was said in the press conference itself as to when they would have traveled, that sort of thing. I don't think the implication from her, even at the time when you listen to her speak, she said they would have traveled to other places as well beyond the countries that she listed. So, for instance, that person may have, from Trinidad and Tobago, gone to, of course, another country, would have gone to Toronto maybe, then on the way back to Alberta. She mentioned cruise ships as well. So what we did is we alerted Public Health Canada. I wrote them last night an email, who's our contact really in Canada. They responded just asking them for the epidemiological data. So basically where the person, who is it, first of all, where they would have traveled to determine when they would have come to Trinidad, so we can at least list and see who they would have been in contact with, that sort of thing. It is not any cause for concern for the population, to be honest, because you would have a person that is presenting in Alberta with symptoms in Alberta, would have been in Trinidad, even if they have passed through Trinidad in the recent past, they would have probably not have symptoms at the time, because you usually can't board an airplane with symptoms. So the chance of transmission is extremely low, if not nil. So that is the part we should be concerned about. But until we get the epidemiological data from Public Health Canada, it will be speculative to say what are the different, there's a host of different iterations of scenarios that could have played out during the course of the time. For instance, it could have been somebody that was contaminated on a cruise ship, had limited contact with Trinidadians, and then went back to Canada via Trinidad and Tobago. We don't know the scenario until I get the results from Public Health Canada.
I hear you, CMO, but so at this point in time, you're saying that we are not aware of the identity of the person. I do expect you to reveal that, and we are not sure at what period of time the person would have been in Trinidad.
No, and I think
how soon do you anticipate you will get that information?
Well, we had communicated late last night to Public Health Canada. They responded during the night, the course of the night into the morning, just acknowledging receipt and informing their regional division. So Public Health Canada is for all of Canada. So they would have sent the query on to Alberta, and Alberta is now, and I think what I have learned based looking at the clip is that, of course, she does not know, she said that she didn't know at this time all the details of travel. So they would first have to interview the client, do a thorough public health history, and of course, once they have that at hand, then they can transfer it to us.
Yeah.
So I think they will do it as soon as they have it at hand.
As the Ministry of Foreign Affairs or the Minister of Foreign Affairs
So
will
we would have-
engage to expedite this process?
Right, so we are engaging via our international cooperation desk, we are engaging the embassy, Canadian embassy, who we have met with twice over the last week. So they have agreed in the event that they have cases or we have cases of Canadian nationality, we will liaise. So we have a point of contact, and our international cooperation is doing that, I think, as we speak, to expedite the public health, Canada's information coming to us.
Yeah, I understand what you're saying, and I agree with you. It's not to create any sense of panic, but you yourself would understand the implications of having that information as quickly as possible. So I presume that we'll be kept updated on that situation.
So as soon as we get the information, we will determine the public health risk. Of course, if there's little or no risk, we will, of course, inform everyone that needs to know in terms of contacts and keep it as tight as possible in terms of but there may be need in the event that there's no exposure at all, that we do say something, that the risk is nil as well. So we will keep the population up to date.
Sure. I just wanted to take your mind to Jamaica, where I believe the first confirmed case was reported yesterday. And in terms of travel to the UK, I believe that person would have had dual citizenship and would have traveled to the UK. Can you shed some light on that and tell us a little bit about what the risk could be in terms of travel from the UK to Trinidad?
Right. So, I mean, the Jamaican case, as you said, is an imported case, is one case, so it doesn't change anything in terms of the relationship between Trinidad and Jamaica to start. In terms of UK, there is travel between Trinidad and UK, and there have been an increasing number of cases. We have met with public health, with the Embassy of UK as well, to look at additional measures, public health measures that can be put in place, seeing that there's a steady increase in the number of cases that they're having. So basically the measures we're looking at in terms of protection is enhanced surveillance at the port. So anybody coming from a UK flight, we are line listing them, basically taking your name, date of birth, place of where you're going to be staying, and a phone contact. We are passing that over through our National Epidemiology Unit. This started yesterday, and that is going onwards to the Public Health Inspectorate as well as the CMOH in every county, and we are doing phone surveillance with them for the duration of the incubation period. It has been done before for MERS. Every year we do it for MERS, and I think it's well practiced in that light. So we're just scaling up the response because we expect, of course, a larger number of people having to be listed. So we're looking at enhancing the capacity there.
Yeah, I'm happy to hear that measure is being implemented because, as you know, the UK is a big hub for travel. In terms of the US, and I raise this, with the greatest of caution, because again, that would be a big travel hub. Is there any consideration being given to the same measures being implemented?
So the same measures just described are being applied to UK, Canada, and US.
Okay. Yeah. Thank you.
Member Dion, all right?
Thank you, Chair. Good morning, everyone. To the Ministry of Finance, in your submission, you mentioned that there's currently a loan of the value $671 million that has been taken for NIPDEC. Now, is that for existing pharmaceutical supplies that would have already been budgeted for, or is this for in cases of emergency?
The information that we provided for you is for the current budget. The question that was asked at the last meeting was about the deficiency in the budget allocation, and this is how the Ministry of Finance would have picked up.
So in the case of us having a case or needing additional funding, where would that funding come from?
So I'm going back to the budget, the current budget for each ministry department. The current budget will be used, and each ministry will determine where in the budget, if it is not in a specific allocation, where within the budget they can identify funding to request of the Ministry of Finance from the current appropriation. Any other additional funding will be discussed with the ministry and the Ministry of Finance. The Ministry of Finance is aware that they will have to, at some point in time, provide additional funding. And the mechanism that we have in place to do that at present is the media review.
Okay, thank you. What is the existing interest rate on that loan?
Give me a second. I don't think I have that information with me at this time, but I can get that information and make it available to the committee, Madam Chair.
Okay, sure. And also, when this arrangement was established?
It was established in February, and the disbursements should be starting anytime soon, this month.
Member Antwine?
Good morning again. To the Ministry of Health, in our response to COVID, how are we treating Trinidad and Tobago? Because we are in a unique position where we have two islands, one country. How are we treating Trinidad and Tobago in response to this COVID situation? And I ask this question because we have created a MUTID, and I'm not seeing any representation from Tobago.
So there is representation from Tobago. There's the County Medical Officer of Health for Tobago, and well as the a representative from TIMA on the committee.
So then you need to update this.
The submission should have been in the original submission. May have been an omission. But yeah, they are well represented on the committee, and their voice is being well heard.
Member Dunarain?
Just a follow-up. Thank you, Madam Chair. So in the event that a case is suspected in Tobago, could you walk me through the protocols that would take place?
So you have a suspected case, right? So the normal protocol is based on the assessment by a clinician. We'll determine whether the person needs to be hospitalized or not. So that's the first thing. A public health professional has to determine, so you're getting to the, once you say it's suspected, it means that there's a travel history or there's relevant exposure that would have occurred. So if you have the case in Tobago, and we would have had cases before, they can be suspected cases. They would have been either home quarantined or quarantine mean not allowing to mingle with the population at an isolation room in the hospital. So you can do either or. So in the event that someone is suspect of developing symptoms, a sample has to be taken. So the sample is usually taken, it is brought to Trinidad with Caribbean Public Health Agency, is the lab that actually does the confirmation for us. They're normally able to turn around the test within 24 to 48 hours. Once the sample gets into CAFA, it usually is done within 4 to 6 hours. So once we get a result, of course, if it's negative, the person goes around on their normal life. I mean, aside from making sure that they're medically fit. If the case is positive, what we have in place is the possibility of bringing the person via a vessel to Trinidad, to possibly Cora or Cuba, to actually have them treated in those localities. The reason for this is that Tobago has suggested to us that, and even using Scarborough is a little bit of a concern. It's their only major hospital, and they're looking at contamination and the reaction of staff and everything else, that the safer bet will be bringing the person to Trinidad if we have a confirmed case.
Okay, so in the event that, with the suspected cases that you all would have had already, what precautionary measures are being taken for the healthcare workers?
Right, so the healthcare workers, so as I said before, they could either be home quarantined, so we would have had cases that would have been quarantined at home, in which case the healthcare workers do phone surveillance, so they will call in every day to find out, they tell you the signs and symptoms, they check and see if you have a fever, if you have any coughs developing. Once you're asymptomatic, meaning you have no symptoms, you are left at home for the 14-day period, and you're allowed, once the symptoms there's no symptoms, then the quarantine comes to an end. There's no implication for healthcare workers really. But in the scenario with the hospital, we have afforded them all the necessary public personal protective equipment that is required and training as to how to use it in the event that they have to interact with a case.
So in the interim of having a suspected case, testing for that suspected case, and waiting the 24 to 48 hours, what protections do healthcare workers have?
They use the personal protective equipment. Isolation generally means that someone is in a room. If they're clinically stable, meaning they just have mild viral-like symptoms, there's not necessarily any great interaction that has to occur. So we limit interaction between healthcare workers and the patient during that time. So they basically, we put them in isolation to make sure they don't mingle with anyone else. If however, they have to interact to do swabbing or anything else, taking blood for whatever reason, they wear their personal protective equipment, and they are trained as to how to do that in the proper way to avoid any contamination.
Okay. And you said that there's a vessel that is being identified.
So I think I'll let the other national security take that part of it.
So this vessel is it a boat?
Morning,
Aircraft?
Madam Chair and members. Yes, it will be one of the Coast Guard vessels that we'll work with Ministry of Health and ensure we also have the proper PPE and bring them from Tobago to Trinidad using the appropriate vessel, and then transport them using ambulance that is outfitted to take them safely to the isolation
Which
venue.
is in Cora. When they come to Trinidad, they'll be taken to Cora.
It is based on the symptoms that you have at the time. We have space in Cora. We are outfitting, almost completed with the outfitting of Cuba in terms of ICU capacity. In the near future, we have ICU in other hospitals that can be used as well. So it depends on the status of the patient. So as I said, 2 tiers. If you have people with mild symptoms, normal viral-like symptoms, we can take them to Cora. We have a space allocated for them. We had 4 beds before. Now we have gone up to 4 plus 24, so we have 28 beds in Cora that can be used.
Okay, Member Antoine.
Yeah, I was just following up and particularly looking at HVAC, the heating, ventilation, air conditioning aspect of it. And so therefore, you are saying that if there is a confirmed case in Tobago that would be transported to Trinidad, the medium would be the Defense Force, not commercial ambulances and so forth.
No, and we're trying to avoid the air bridge because we don't want to contaminate people on the air bridge, and that's why we looked at the route of going with the vessel. Actually, there's a possibility of using private helicopter as well, but again, the ease of isolation in a larger vessel is better in terms of the airflow and the way we can isolate a patient on a vessel. So it might be the preferred route at this time.
Okay. Dr. Bodo.
Thank you, Madam Chair. CMO, just a few follow-up questions based on the previous questions. Now, you introduced yourself as the CMO of Trinidad and Tobago. So just to clarify, you have jurisdiction over what happens in Tobago. Can you just clarify what would be the reporting relationships?
So the person that I would liaise with most in Tobago with regards to this kind of response is the County Medical Officer of Health, who takes technical advice from my office directly. So that is my liaison. Of course, we also liaise through the Tobago House of Assembly if need be. But the Quarantine Act, which is what, and the Public Health Ordinance covers Trinidad and Tobago. Yeah.
Right. So I just wanted to go back to the Cuba Hospital, and I'm sure that you are very happy that use is now being made of the Cuba Hospital. But can you explain to me, I would have heard the Minister indicate that I believe on Friday, some sort of operationalization will take place. Can you give us a sense of exactly what is going to be happening at Cuba, exactly what is going to be used for? Can you explain?
Okay, so we would have looked at the building plan. We would have looked at the HVAC systems to see which areas, which towers can be isolated in terms of utilization. And we have earmarked a 112-bed space within the pediatric tower that can actually be used safely without contaminating any other area of the building, meaning radiology or the other tower, which is the adult tower. So 112 beds, their isolation capacities, there's 6 beds there, 6 isolation rooms, as well as 6 ICU rooms in that wing. So all of them can be utilized for this purpose.
So how are you going to select the patients that are going to be using these facilities?
So
What is going to be the process?
Once CUVA is fully functional, up and running in terms of the capacity, I think all patients confirmed regardless of the medical status should be going to CUVA, because it's a controlled environment and it will be better to handle them at CUVA.
Right.
In the event at present, because CORA has the capacity for stable patients, we will send stable patients to CORA in the interim while we wait for CUVA to reach its full capacity.
So you're saying that CUVA will function as a critical care facility or just as an isolation facility?
Isolation and critical care.
Have you or has the government given any thought to utilizing the Augustus Long Hospital either as a quarantine facility or was to utilize the additional 50-bed capacity that is available there? Hopefully that is still available there.
Well, I pushed, from my office, we would have had some preliminary discussions with them, just looking at the capacity in different sectors of the country in the event that we do have spread nationally, looking to scale up. So I would have had conversations with some members related to use of Augustus Long. We have not gone full ahead into the discussion as yet. Defense Force, again, has said that there's some capacity there in terms of that they can do quickly, get a number of beds up and running. So we have a number of areas in different localities that we can pull to, but I think CUVA is the primary aim together with CORA because of the large capacity that is there and is already set up as a hospital.
Agree, but I'm sure that, you're familiar with the Augustus Long and it's ideally located and, for an isolation facility.
Of course, yeah.
So that has been on the cards, you're saying?
Yeah, it is being thought of. We just have not had any concrete arrangements put in place as yet.
Yeah. CMO, I know that that you would be leading the multi-intersectoral team and so on. But I'm just trying to think ahead, and hopefully this scenario wouldn't occur, but in the event that we do get, a critically ill patient, we'll be looking at the critical care. In terms of protocols that you're implementing, would you have the benefit of respiratory physicians, experts, and so on, pulmonologists, and so on? And if so, can you share who these experts are?
So generally speaking, we rely on the ICU physicians. And I think in terms of respiratory failure will be the predominant thing that you'll be dealing with in this case. So the ICU physicians have assured us that they are well capable to deal with COVID-19 in the way that they would have dealt with H1N1 or any other pathogen of a similar nature.
Yeah. Have you engaged, I just wanted to ask, have you engaged the expertise of those who would be working at CORA, for example?
Sure.
I know we have about 3 or 4 very well recognized.
Yeah, CORA is front
respiratory.
In terms of the technical expertise and specialists, CORA is leading the charge from the North Central. So the experts there are fully available, and they're part of our committees that are setting up to deal with the clinical aspects of it.
And their input is available to you in terms of making your recommendations going forward?
It is. We have set up a committee chaired by the principal medical officer of institutions that includes all the heads of A&Es, the directors of health, and they got the clinical inputs from CORA as well.
I'm just thinking ahead as well in terms of, and again, I hope that this scenario doesn't occur, whether you would need additional staff, critical care staff, and, other doctors and so on.
Yeah.
Is there any intention to engage, for example, unemployed doctors in this regard at this point in time?
I think all options are available to us at this point.
So you're looking at the permanent secretary to answer that question.
But I mean, yeah, all options are available to us, and we have a cadre of physicians that are trained, and we know at finding difficulty with getting employment at this time, that we would be happy to use from time to time for different purposes. I suppose this being one of them, if the capacity is required.
If I give it, Madam, just Madam DPS Finance, I just wanted to clarify with regards to that allocation. In your response, it was stated that the disbursement of that loan would be on 21st of February. Can you confirm whether that loan has been disbursed to NIPDEC, the additional loan to meet the shortfall in the budgetary allocation?
Okay. The loan has been agreed to with the lending agency, and the finalization of that is taking place, as well as the administrative arrangements are being made for the facility for NIPDEC. So to access the facility, NIPDEC is supposed to be accessing can access the facility from this month.
Today is the 10th of, 11th of March. So you're saying now?
Yes.
It's available now?
Yes.
Okay, just wanted to confirm. Thank you.
Okay, so I just wanted to ask a question in terms of to the Airports Authority with respect to the passengers who were denied entry. Have you all been in a position to identify the airlines by which they had come to Trinidad and Tobago?
Madam Chair, the passengers who would have denied entry would be on the basis of immigration. Immigration has not necessarily shared that information with the Airports Authority, so I'm not sure what airlines they would have come from.
So you don't know? That's what you're saying. All right. So I want to find out in terms of Airports Authority, because in terms of your submission, which you had sent to us on the 14th of February 2020, we'd asked about things like your HVAC systems and the maintenance and cleaning of those. And basically you had said to us that at PRCO there's a quarterly maintenance that you conduct, and you do it as a needs basis at A&R Robinson. And I'm trying to ascertain if from your interactions with the Ministry of Health and following best practices, are you satisfied that the system which you had and which obtained prior to the COVID-19, if these are satisfactory, if there are any plans to improve the, increase the frequency of your maintenance of these systems?
Well, Madam Chairman, we have the perspective that the systems we have in place is satisfactory, and given the nature of what we have learned in terms of the best practices in COVID, it's spread by drop-ins rather than the issue of going through the HVAC systems. So we have the perspective that what we have in place is sufficient given the nature of the risk that we are facing. It's an issue of risk management, but of course, we are not experts in terms of this, so the Ministry of Health is the guidance in terms of this.
Have you had any consultations with the Ministry of Health on this?
We working very closely with the Ministry of Health in terms of this issue, in terms of COVID, and that's why our perspective in terms of what we are doing is what is required in the circumstances, given the nature of what we are facing. It's not the Ebola type situation we have been advised. It's a different kind of pathogen that we are dealing with.
Okay, so then maybe I should turn it over to I don't know if it's the Ministry of the Health or whether it's the CMOH in terms of the systems that are in place or practice by the Airports Authority of Trinidad and Tobago.
So basically what he's saying is that this pathogen is spread, from what we know so far, by droplet infection, which is different from an aerosolized pathogen. Aerosolized meaning that there are smaller particles that can actually go into the air conditioning system, that can go into the vents quickly. These pathogens are a little bit bigger, so they spread by droplet. They go about 2 meters if you sneeze or cough away from you. The greater risk is in terms of hard surfaces, so doorknobs, hand railings, tabletops, even floors, seats, those kinds of things. So the recommendation has been to continue the sanitization often, as frequently as possible, using some sort of disinfectant wipe or even a hypochlorite and water solution will suffice and do a very good job. So that is the more critical thing rather than the HVAC in this sort of scenario.
Okay, thank you. And therefore, then back to Airports Authority, in terms of those recommendations, if you can give us an idea of your maintenance practices in terms of the airport plants and in terms of the baggage handlers.
Okay, our practices in terms of the issue of the sanitization has been to use the material that has been indicated by the Ministry of Health in terms of cleansing the areas, the doorknobs, the various areas. In addition to that, we have dispersed throughout both PRCO and A&R additional hand sanitizers for all through the airports. All right. What we have attempted to do, and this is a part of the plan, to make sure that not only we have disbursed them, but we are making sure that our janitorial staff are watching and looking to make sure that they're always available for people in the toilets at the areas where you, doorknobs and those kind of things. We have also distributed additional quantities of things like Lysol, the Clorox-related equipment, to make sure that the place is in fact kept in a sanitized state. That's the kind of thing that we have been doing, Madam Chair.
Right, and in terms of the baggage handlers and the employees of the, that you said are the employees of the airlines and ground handler staff, the submission almost gives the impression that you all have a hands-off for that, and therefore maybe, I see you shaking your head, so that at least gives me some comfort. Maybe you can expand on how you all have tried to...
Subsequent to that, what we have done is that the ground handlers are really operating on the basis of a license from the Airports Authority, and also they're directly contracted by the airlines. But what we have done on the basis of the license is to ensure that the ground handlers have also put in place the required PPE and the required sanitization that is required. So all of the submission would have been said like that. We, as the landlord of the facility, recognize our responsibility and has in fact gone into the ground handlers to make sure that they are also following the same process that we have followed.
Okay, and then I want to ask, in terms of the airlines, while I know they're not directly under you, but again, in terms of you securing the airport as much as you can, I see in a press release of, I think it was last week, Caribbean Airlines had set out the things that the measures they're taking. In terms of, let me ask this, in terms of your measures and the measures, have all the airlines submitted to you, not just CAL, but all the airlines that come here, have they submitted to you the measures that they intend to take?
All the international airlines have submitted their protocol. CAL, in addition to CAL, that's one of the first things they did. They submitted their protocol to the Airports Authority in terms of dealing with this. Right? So we have that information.
Right. And do you have any measures in place to ensure that these protocols that they've set out in paper are being complied
with?
That's
my operations department at both PIACO and ANR have been mandated to make sure to use these SOPs that they have indicated to make sure and monitor to make sure that they're in fact following.
All right, so you told us about CAL. The other airlines have done so, and I'm talking about American,
yes, they
Air
have.
Canada.
In fact, they did it even before CAL. They did it early because of the requirements of the international flights. So we have their information, and we have in fact been monitoring to make sure that they're conforming to it.
Good, okay. Thank you very much. Member Deonarine.
One of the earlier submissions mentioned that we had, I think it was 10 persons who were sent back to their home countries. Who usually foot the bill to send back a person to their home country? Is it the individual who is a non-national of Trinidad and Tobago?
Morning again. Usually the airline is responsible for repatriating, well, carrying back the person to the place of embarkation. That's the airline's responsibility.
So in those cases where persons were sent back, the airline...
The airline was responsible for financing and taking them back to their last port of call.
Okay. Immigration is here? Yes. Oh, sorry. What changes have been made in terms of the line of questioning by the immigration officers who clear persons entering the country? And I'm asking this because just last week, Monday, I passed through the airport, regular citizen line, and The only thing I was asked was whether I've been to China in the last 14 days. And by that point in time, it had already spread to other countries. When I left the United States, they had a list of countries that they were asking me if I have visited to. So what updates have been made in terms of briefing these immigration officers as to their line of questioning and interrogation for passengers who are entering the country?
Okay, effective the 27th of February, our officers at PRCO and Arthur A&R Robinson have been requested to have the passengers fill the declaration forms, the ED cards, and of course they would be required to go through the passports, see where the persons have been in the last 14 days or by extend the last 6 weeks. Also on the ED card, the person is required to indicate what countries they have visited in the last 6 weeks. And the officers, if they don't see that part filled out on the ED card, they will request the information from the passenger and go through the passports to see to ascertain whether those countries were visited or not.
Member Antoine.
One again. I want to look at, in terms of our worst case scenario, and look at containment and sanitization. If there's an outbreak, and again, we have 2 islands, Trinidad and Tobago. If there's an outbreak that we have to contain and that we have to sanitize any areas, because you speak of it being large droplets, as the case may be, rather than airborne. Who will be the lead agency for dealing with sanitization and containment? What resources are available to us right now? In terms of the disinfectant that we use, would it be able to be produced locally, or would it have to be imported? And do we have the necessary hazmat suiting and so forth for those involved in sanitization or containment?
If I could start, and then maybe the other agencies can fill in. So basically what we have looked at are different scenarios in terms of what level of spread you have in a population, right? So we have, in terms of the committee, so we are looking at 3 levels. We're looking at tier 1, 2, and 3 to keep it as simple as possible. So tier 1 is basically a patient or a person would have come in from an airplane from one of the countries of risk, maybe a national returning. What we do is put on your PPE from the onset. You go straight into home quarantine, in which case your chance of spreading to anyone else in the population is very low. Even if you come back as positive, we treat you at home or in an isolation area. There's little to no spread that we categorize that as level 1. So there's no great community risk of spread. So level 2 would be someone that would have come into the population, local again, from maybe not one of the countries listed on the restriction, from another country. Would have had exposure along the way, maybe 4 or 5 days down the road. They present a health facility as a positive case. We test and they're positive. We isolate immediately, but there would have been, let us say, local spread. Maybe they went to work, they went visiting relatives, whatever. So there's a small handful of people that would have been directly in contact during the preceding period. We categorize that as level 2. And in level 2, what we're looking at as local containment, possible closures of schools or workplaces that there may have been some contamination, as well as dissuasion of mass gatherings. So that's level 2. When we look at level 3 escalates to massive community spread. So meaning a large group of people are now positive and they're in different localities all throughout the country, requires or may require a level up to and including a state of emergency, which is under the powers of the president in terms of emergency and can be triggered by a public health event. And as you know, this has been added to the quarantine schedule by the president on the 31st of January. So it is a quarantinable disease and it is a reportable disease. So our levels are 1, 2, and 3 based on I think you were describing more a scenario of level 3. So in the level 3 scenario, we're looking at simple things can be used for sanitization. We have seen using bleach and water as a mixture is a very good sanitizing agent for hard surfaces. A 1/3 cup of bleach to 1 gallon of water is what we normally use for sanitization, and that can work very effectively. Again, as it was mentioned, sanitizing wipes for hard surfaces of any type. When you're looking at aerosolize, we saw abroad, we would have seen images of people using large handheld thermal foggers, what we call, to actually disseminate these agents into the population in a large way. I think desanitization is better, to be honest, because we don't have aerosolized spread. So I think we need to stick to the hard surfaces and do that sort of sanitization. The lead agencies within the health sector will be health. We will lean on education, and we will lean on ODPM as well as national security, including ODPM and the Defense Force, if widespread sanitization is required.
Defense Force, dealing with sanitization.
Well, if I may speak first, I think what Dr. Parasram was relating to was the relationship between the ODPM and the Ministry of Rural Development and Local Government. That ministry would take the lead, given that they have capabilities in terms of the communities and the role of CPEP and URP, et cetera, in this. The ODPM would continue to do what it does, that is coordinate with regard to whatever assistance may be needed, that they may not have the capabilities at this point in time.
And if I may answer, Chair and members, the Defense Force will provide the assistance with the guidance from Ministry of Health in HADR operations as required, as we have done in the past.
But would we have a hazmat team? Yes, okay.
But if I might just add to what the other members of the team from the ministry just said, the fire services are also standing by to assist in operations such as that. The fire service actually has a set of hazmat suits, and in fact they've been recently given a whole collection of suits from the ODPM. So they stand ready to provide support in this regard.
With sanitization and containment, that would revolve on mainly national security through the fire service.
With support from Ministry of Rural Development and Local Government.
Okay, so I just want to ask in terms of, and this is to the Ministry of Health, we were told that a subcommittee of the MUTED committee was established to develop criteria for measuring things like whether you should have banning of large public gatherings and all of that sort of thing. And a report was supposed to be submitted yesterday. And was that report submitted? And if so, if you can give us an idea of some of the recommendations contained in that report. If it wasn't submitted, when is it likely to be?
Yeah, so the subcommittee would have, and the 3 stages that we went through, painted the scenarios, and of course is a simplified version of the algorithm that we have to deal with tiers 1, 2, and 3. So the subcommittee was, we met twice so far, the committee. We would have met on Thursday last week, and we met on Tuesday. We agreed to meet every Tuesday going forward until this crisis abates. But we already formed the subcommittee. As I said, we are 99% happy with the way the tiers are laid out. We're just adding in additional columns to make sure that everybody knows who's responsible. So that responsibility, which should be done between today and tomorrow, and a formal minute will be sent to both Ministers of National Security and Health. But we have communicated with the Minister of Health a sort of draft version this morning. He actually sat in for a few minutes in our meeting yesterday as well.
Okay, and with respect to the CARICOM meeting of the Ministers of Health of the region, I believe what we were told is that the meeting would have produced some sort of standard procedures and protocols. And you all had not as yet got the official report from that meeting. Has that as yet come?
Thank you. Chair, yes, we got that from the CARICOM Secretariat, and we are looking at that as we speak. We're reviewing it through the committee also.
And is there going to be any sort of public release with respect to what has been contained in that report? And if so, when?
Once we have reviewed it from a technical perspective and we make a decision at the government level, yes, we will communicate same to the public. I expect that should be by early next week.
All right. And another question I just want to ask. In the public domain, there is information that a number of private labs have been advertising COVID-19 tests. And I've heard your public sensitization saying that CAFRA is the only authority. Is there any system, procedure, mechanism available to the Ministry of Health to prevent these advertisements by these particular labs?
I don't think there's any mechanism to prevent at this point, to be honest, in terms of accreditation of the labs. However, we would have met with at least one of the major labs, meaning the director of the Trinidad Public Health Lab. Once we have learned that other persons were attempting to do the test, to find out what sort of tests are being done and to reaffirm that CAFA is the body that will be the reference lab to confirm, or actually not only confirm, but say something is negative, because we can't have, false negatives persons around. So CAFA still remains. CAFA would have done a media release to that effect as well, reiterating the point to the population. So
if I understand, you've been doing sort of moral suasion. You've done it with one lab. I guess you may have information with respect to the labs who've been advertising. Is there a structured plan to meet with all of them and use moral suasion?
Well, it's really to find out what is being done in terms of what testing is being done, if they're using rapid kits, if they're doing full polymerase chain reaction, how they have been validated, if they have been validated by whom. So we want to do a fact-finding sort of mission, if you want to call it, in the first instance, to see how many labs are offering testing and what they are offering to the population. And then, of course, CAFA will be involved in the team as well. So CAFA and the Trinidad Public Health Lab are the two lead players from the ministry side. So we're trying to have that sort of conversation beyond. It is a critical stage, and I think it's something that has, for us, been concerning. Because, for instance, if you have a suspected case, it goes beyond the lab test itself. With the way it's set up, every test that goes to CAFA, prior to a private lab being set up, we would have known about it, meaning the Ministry of Health Surveillance Network would have known about it. The public health measures would have been put in place from the moment that somebody would have been suspect. If we have labs setting up everywhere, doing the tests, one, there's the risk of false negatives and false positives, but there's another risk that patients will be testing outside. There's no communication to the ministry. They may come back positive or negative, as the case may be, and there's no public health measures in place to deal with the cases. So we stand by CAFA's decision to send out the press release and that they should be the only reference lab at this point. And we will try our best to meet with all the labs, if possible, that are offering it, to actually have the discussion to see where they're at present.
Okay, so I'm a little confused, because is it then that you're saying that there's the possibility that labs are doing proper tests? It's just that you don't have it's a reporting issue? Or is it that labs are incapable of doing it?
We have to do the assessment to see if labs actually have the capacity to do the proper test. We have larger labs in the country that have been doing tests for other things that have been validated and verified by international experts. So I think that's the first discussion and the first interaction we have to have, and we have started that with one particular lab.
All right. So basically, you're saying to the public that the only people accredited to do it is CAFA. Is a sort of precautionary.
Yeah, at this
measure.
time, until we can confirm, and when I say we, Ministry of Health and CAFA, because CAFA is responsible for testing for the region, can confirm that another lab can do it and has been accredited to do so. If that is the case, then we will in terms of endorsement, we will discuss that further as it goes.
And then, of course, there's the reporting mechanism.
And the reporting mechanism has to be put in place as well.
Member Boubou.
Thank you, Madam Chair. CMO, I just wanted to follow up on this whole issue of results and accreditation, because every month in my own medical practice, I will receive a laboratory report from a lab that I've never seen before. So it would appear that, you know, the first of every month, somebody decides to open a lab in this country. Can you indicate to us how many labs are actually accredited and what are the accreditation standards? I know that may be a difficult question. Can you indicate to us if that is the case? And the follow-up is that, is the ministry in the process of trying to certify and accredit laboratories in Trinidad and Tobago? Are we in that process?
So the process has begun, and the concern is shared with the Ministry of Health that labs are opening quickly, and they may not be validated, and then we have the issue of false results to the population. So the concern is there. I will have to get back to you with regards to the numbers of labs that are existing and who is accredited and by whom. So we can get that information to you.
Yeah. In regards to this, because this is a public health emergency, in regards to this, is there any power under yourself or the Act or the ministry that could now allow a directive to be sent out to labs that may not be accredited to desist from offering that test? So is that not possible at all?
I will have to
the point being is that, you know, the implications of a false positive or false negative, you know, are serious in this particular circumstances.
Yeah, I'll have to verify with the legal department of the ministry before I can give you an answer to that one. But as far as I'm aware, there's no powers under the existing legislation.
And it may be a good springboard as well, just by way of advice for the process to be fast-tracked now.
Sure.
I just wanted to go back on that. You know, at the end of the day, CMO, all of this responsibility lies on your shoulder. If things go good, you may not get the credit, but if things go bad, you're the one taking the fall. So as a colleague, I wouldn't want to be in your seat. But I just wanted to ask your opinion. I know, notwithstanding the fact that the recommendations of both the CARICOM and the other bodies are not public information yet, what are your own thoughts in terms of community spread? We've seen community spread taking place very quickly. In Italy, for example, in Washington State in the USA. What are your own thoughts in terms of whether we should be issuing some sort of advice with regards to public gatherings, non-essential travel, and the whole issue of social distancing? What would be your thoughts on that, pending official recommendations?
Well, I believe the practice of hygiene, hand washing, coughing into your sleeve, trying to avoid touching your face as well. The social distancing is very important. We are in the influenza season still in Trinidad, which runs until the end of May and in the Northern Hemisphere. So it will hold well for the influenza as well, or any other common cold-like illness. So basically, in terms of the sanitization that we described, I think an increase in the amount of sanitization that is done in public spaces is important. There's a meeting with the chamber on Monday that we are trying to attend as well, which will actually be able to give us a springboard to get private sector involved in the way they sanitize the public spaces. So we're looking at supermarkets, we're looking at handles, we're looking at trolleys, those kinds of things, even simple measures like having disposable gloves when you enter a supermarket, you get rid of it when you go out, just like we have at food establishments. I think those will take us a long way. When we looked at the mass gatherings, again, it's based on the tiers. So we try to define it based on the tiers. Because we have no cases, we have no real risk of local spread at this point, we are dissuading mass gatherings generally. Because it is something that will spread this sort of disease and influenza. So if the population can minimize trying to have mass gatherings of any sort, it will go a long way in terms of community spread if and when it occurs. But again, it's based on the tiers of identification. With the mass gatherings in particular, there may be some legislation that can be enacted that can, under the SOE, if we go to level 3, that can actually stop people from congregating based on the state of emergency.
Yeah. Any advice to the schools at this point in time?
The advice we have for the schools, of course, practice the basics again. So the same hand washing, hygiene is most important. So we have had meetings with education. Ministry of Education is on the committee as well, and they have gotten out to their principals and their school supervisors that the basics should be practiced every day. I think yesterday we had a meeting with them, and they said the principals are now going through hand washing every day in assembly. So that is happening already. The sanitization of the hard surfaces is happening as well, and we want to get the public health inspectors as well and the nurses involved more heavily to make sure it's being done appropriately. Of course, simple things like making sure there's soap and water in the schools at all times is very important. Beyond that, trying to get them aware, the older kids, of the signs and symptoms. If someone is ill, that they need to stay out of the school system, and it goes for work as well. It's very important. So once you are ill, you isolate yourself as early as possible. Yeah. Will prevent community spread.
Yeah. The analysis coming out of Wuhan and
yeah.
Italy, which suggests that the community spread was taking place and then exploded.
Sure.
Are there any lessons that we should learn or have learned or could be learning from those situations?
I think what we looked at
that could be applied in a preventative manner.
Of course, and what we looked at in Italy is there was closure of schools, but there were closure of schools very late on in the epidemic. So, and that's why we think if we take a more aggressive public health approach, if we have 1 or 2 cases in an isolated area and we do closures early, then we can limit spreading to other areas. So we will err on the side of caution and try to do closures. I know it is disruptive, but in terms of getting less cases and less persons affected, the earlier we act, the better in terms of public health response. And we have seen in Italy that it has not borne fruit to act late in terms of at least those sort of large public sector measures and closures and etc.
There is no case for bringing the August vacation in Easter as yet.
Well, I mean, in scenario 3, it looks at all of those things, and our SOE will do that.
Yeah, no, I'm just trying to ensure that we are doing everything possible.
Yeah.
That could prevent the sudden cascade that occurred in
right.
Italy. I just wanted to throw a couple of things out, but if I could direct my question to the Port Authority of Trinidad and Tobago with regards to what is actually happening in terms of port screening, and with the approval of the GM, if I can ask the Port Medical Superintendent, Dr. Roach, to give us a feeling and idea of what actually happens at the ports in terms of screening. Good to see you again, Dr.
I don't know why you picked me, Dr. Boudou, but I will try my best.
I haven't heard your voice in a long time.
I see. Right. We've been doing everything, following all the protocols. We've been following all the situation reports. Our nurse is an occupationally trained nurse and also trained in health, safety and environment practices. And we have been trying to keep up to date, in fact, ahead of the game. Our CEO is very concerned and in touch with us all the time. We have 2 mandates. One, keeping our staff safe, keeping our staff educated and protected, and also making sure that we do not allow anything into the country that would put the country at risk. So our problem has been with the cruise ships in particular. And I think I would like to ask our CEO to bring us up to date on that, and also to ask our occupational nurse if she has anything to add, because she has been very busy training our staff in the use of hand sanitizers, in the use of PPE, in the use of masks, things like that. She's been trying to segregate different groups and go particularly to group, to use the different groups at different levels according to what they have to manage. So maybe she could tell you what she's been doing, and our CEO will tell you more about what we've been doing in connection with the cruise ships.
Sure, thank you. With regards, before you leave, Dr. Roach, with regards to CEDRUS, because that is an issue in terms of one of the ports where you can have entry from South America and so on.
As far as I know,
are you satisfied that there is a
as far as I know, we are not in charge of CEDRUS. We're in charge of the Port of Spain. We're in charge of the Port of Scarborough. As far as I know, we have no connection with CEDRUS.
Sure. Is there anybody in the dossier who can answer that?
No.
Jurisdiction.
Sorry. I'll start again. Chair and members, there's an official port at Cedros, and Coast Guard is located there and operates 24/7. And we work alongside customs and excise, and we continue to monitor entries that come there for this purpose. There's also a health office there, but we haven't had any issues along this so far, but we are prepared and continue to monitor.
So what happens if an immigration officer detects a person who would need further screening or surveillance? Or
So
how is that operationalized?
County Medical Officer of Health for St. Patrick is in charge of that. I spoke to him after yesterday just to make sure he's comfortable. They have thermal scanners handheld at the port of Cedros, and they are working closely with immigration down there to ensure, and customs, if they get persons of risk, that they do the necessary screening and isolation.
So you're confirming that they do have the
They do,
handheld
yeah.
thermal scanners?
They do.
Yeah. Sorry, I think there was going to be a response about the
Just 1 minute, if I can, thank you, Dr. Wood. Would that apply to all the other ports, Chagaramas, Point Lisas, all the other ports? What happens in those?
So all the major ports in Trinidad and Tobago are covered by port health officers through the CMOH offices at the different counties. And they all have handheld thermal scanners.
If I may, Madam Chair, the ODPM was tasked by the Minister of National Security to secure additional scanners. And I was speaking in particular to the stationary scanners. The ODPM having the last time secured the ones for the airport that we use right now. I can inform you that through discussions with the Embassy of China, as well as the United States, commitments have been made to provide Trinidad and Tobago with both handheld as well as the stationary scanners. That is in process right now.
Tabudo?
Yeah, sorry, I think there was going to be a follow-up with regards to the cruise ships and surveillance with regards to the cruise ships.
Thank you, Dr. Roach, putting me on the spot. Good morning again. Well, the standard, as was said the last time, standard operating procedures, standard protocols regarding port health are being followed, regarding immigration are being followed. So the manifest information is coming in from the agents of the vessels. The health declarations are coming in from the agents of the vessels, the master of the vessel, sorry. And the port health is having a vigilant screening of information being provided. I know the chief medical officer is directly involved as well. We would have turned back a vessel about a week or two ago, and they are being monitored very closely. Additionally, even though vessels have been given pratique and passengers are allowed to come off, I have mandated with our staff that we also be vigilant and keep our eyes and ears on the ground. And if we see persons, displaying any symptoms, etc., we will report it back to port health. So it's basically all hands on deck, and everyone has to be vigilant. So that's the approach we're taking.
CMO, I just wanted to raise one issue which I'm a little bit uncomfortable with, and I'm sure that you are as well. Now, you mentioned that there were 40 tests conducted so far since the testing started. I'm presuming that these tests would be sent from patients who would have presented fairly sick or the symptoms that would warrant concern. My concern is that these patients would have come through the accident and emergency, the casualty, and therefore if such a patient, tests positive, it means that they would have already been in contact with others in the emergency department and staff and so on. And so the follow-up question, you may want to answer that, but the follow-up question to that is that would there be any benefit at all in establishing a hotline, or if these patients coming from a general practitioner or a health center, whether there should be some facility, temporary facility created outside of the casualty, for example, with a tent or something, where they can be screened without interacting with the other patients in the emergency department.
Right, so the majority of cases that we would have gotten would have actually been with mild symptoms, low on the suspect list in my view, when we looked at the cases that presented. So they would have been traveled to UK in the early days of the epidemic, those sorts of things. They would have been home quarantined to the most part. So there wouldn't have been the risk. The normal process is that the CMOH sends out a team to do the swabbing at home. So that is being done at home, so we don't contaminate the A&Es and the hospitals per se. So in most cases, that would have been done at home, sent to the labs directly. And then, of course, when we get the result, then we take a decision there. So far, no positives.
Right, so these are the cases that are selected now based on the travel history.
Sure, yeah.
But we could be approaching a situation where
Right.
we could be going beyond the travel history now.
Right. So
That's
yeah.
the scenario I'm looking at.
So we're looking at persons, a few people would have come into the hospital with those sort of symptoms. They would have been placed with PPE directly into the isolation areas as soon as they enter. What we have done since is, as you suggested, there's a separate area now for flu-like illness.
In the A&Es?
In most of the A&Es, if not all, and the primary care centers as well. So they are separated out, 2 levels of triage. So there's triage, basically you have flu-like symptoms, you go into one area. You have any other symptoms, you go into another area. And then, of course, you triage from within that area to determine if you're at risk of COVID or anything else.
Yeah. But how separate is separate? Is it in the same building or is it?
Physically separate, every locality will have its, intricacies in terms of where they have we have suggested to all the heads of A&E to earmark spaces. We have used it well before for influenza, so we have earmarked spaces in all the health centers, actually, as well as in the A&Es, that we have physically separate localities that we can use. In the ones that we would not have actual physical space, we ask them to use other areas, I suppose, of the car park as well, with temporary structures, so that we could house them there.
So that's
has been the instruction has gone out over a week ago to have that done at all the A&Es. We are the PMOI is instructing the group to ensure that happens.
Yeah. One last question, Madam Chair. At the last meeting, I asked you if you were going to play Mass. I wouldn't ask you if you played Mass. But it's 2 weeks today, basically, from Carnival. Right. And we know that would have been a high-risk exposure. Is there going to be any enhanced surveillance in this coming week or two? Right. With regards to whether cases may have come into the country?
Yeah, and so there has been enhanced surveillance. I think we're looking at severe acute respiratory illnesses, SARI, which is a heightened level of surveillance for that particular illness. So there has been heightened surveillance even before Carnival that would have taken place. Generally, after Carnival, you see a peak in influenza cases as well. So every year we do have a heightened surveillance level around this time. So it continues into this year.
I just want to go back to the influenza and the deaths from influenza. Since the screening and the awareness for COVID-19,
yeah.
Those patients who die, unfortunately, would they be testing in retrospect and so on? Even if it appeared to be influenza, how do you confirm that there may not have been a case of COVID-19?
From autopsy. But generally, this sampling is done at the time of autopsy. So the pathologist will usually guide the sampling and they will send it off to the lab in the same way if they think somebody has a travel history that is suspect. Yeah. So that can be done as well.
There'll be no confirmations? So
no. Thank you. And you asked about the hotline? Yeah. You want to answer the hotline? Sure. Yeah.
So, Chair, with regard to the hotline, the ministry is setting up a hotline. We expect to have that operational by next week. Notwithstanding that, what persons can do right now, they can call the respective CMOH offices or any health facility to get that information. But we are setting up a dedicated hotline.
Yeah, thank you. P.S., can you tell us a little bit more about the hotline, what is intended to achieve, and what the process will be when you call the line?
Okay, so I'll let CMO speak a little bit about that part of it.
That's for the public information.
I had reached out to TTMA to give us a list of doctors, as you asked to use the house officers that had not. So I think you need to have a medical person on the other side of the line to start with. So we're using the medical doctors. TTMA has already given us a list of people that are potential persons that can be used. So the basic is one, to give public information, FAQs, as it relates to the virus, what are the signs and symptoms, who to present, and it also does a bit of phone triaging, so we don't end up with our A&Es being overloaded, our hospitals being overloaded, so that they will guide you maybe to stay at home if you have mild symptoms. A team will be sent out to you based on the discussion and based on their risk. So they will all be trained once we get them on board as to how to answer, how to determine levels of public health risk in terms of the threat. If they have any concern, they will relate with the respective county medical officer of health, who will guide further as to how to proceed.
I just want to throw something out, CMO, for consideration. About 2 weeks ago, I was able to get a constituent of mine have a medical diagnosis confirmed by doing a FaceTime phone call to a colleague of mine and showing a picture of the constituent's eye. Would you consider, everybody has 2 cell phones in this country, would you consider using the FaceTime application to make that hotline perhaps more helpful? So in terms of a FaceTime call, so the physician can speak directly.
Yeah, so
with the
what we're
concerned
doing as
person.
well as we're trying to give the persons who are hired a cell phone. And if once that cell phone has data on it, then of course they'll be able to share information from the clients directly to them, pictures, etc. So that is a possibility.
So the technology will be utilized in
Yes,
that
yeah.
respect. Thank you.
Just to follow up on that, CMH, in the response of the Ministry of Health, when we asked the question with respect to United Kingdom and the National Health Service, which it runs on this online, is this what we're talking about?
Well, the National Health Service they do telemedicine, they do actual phone triaging, which has legal implications if it's done wrong. For instance, if you tell someone who is very ill to stay at home and something happens to them, who bears the liability? So that system has been completely worked out in the United Kingdom. So there is a variance, but it is heading in that direction.
All right. So in their response, they said that the multi-sectoral committee has instructed the Ministry of Communications to develop a communication plan for COVID-19, which explores all options.
Yes.
Could you kind of expand on that and let us know where that has reached?
Right, so there is a plan, which was a Ministry of Health plan prior, that is to be submitted. It already has a budget. Of course, you know, there's communique that would have gone out from the ministry over the last few months on COVID, so there's information that has already been developed. What we are trying to go towards the messaging, the simple messaging, the hand washing, those sorts of respiratory etiquette, and in particular the sanitization of surfaces we believe will be a great public health asset to prevent spread. So we're trying to reach that population, the population at a different level. So basically communication is working together with our corporate communication at the ministry in a subcommittee to develop further beyond this initial plan, to look at other measures, including using possible apps and anything that may be available to us. I know we have generated television ads, which is in the process of being rolled out very soon as well, as part of the plan. So the plan is already completed, but we're adding to it other measures based on communication and the discussion with their stakeholders.
Okay, and that plan would incorporate uses of the facilities of iGov, TT, and
yes.
iGov Chat. Okay,
yes.
Thank you very much. Member Antoine?
Good day once again. In the response from Port Authority, when the question was asked, reference the water taxis, Port Authority responded that they do not manage, operate the water taxis. That is a local item. But we are looking at the cruise ships, we are looking at the airlines and passengers coming off the airline, and we are monitoring them. But we also have the CARICOM jetty, where we have a lot of interaction between St. Vincent, Barbados, Grenada, and Trinidad and Tobago. On the other hand, we have the yachties who are coming into Trinidad and Tobago from further abroad. Is anyone or any agency responsible for monitoring these people? Just as they come off the airline, we monitor them at Piarco and in our Robinson Airport, but are we monitoring those who are coming off the CARICOM jetty and those who are coming off in Chagaramas from the yachties in terms of the COVID?
So we have scaled up our response from a public health perspective in terms of the yachties and those additional ports. I think immigration may want to come in as well to say what has been done from the immigration side. But we notice, as you have noticed, it's sort of a easy entrance into the country, and there's a cause for concern, and that's why we have scaled up from the public health perspective in those areas.
Yes, Madam Chair. The officers who are based at the Chagaramas or any of the ports, any of the 14 ports we have throughout Trinidad and Tobago, they have been advised to ask further questions of passengers or crew members entering the country from where they came, and if they show any signs of illness, they are referred to the port health officers who are available at the different ports of entry, the 14 points of entry.
I don't want to go to a worst case scenario, but if somebody with the virus comes in, then there's a possibility that they can contaminate the immigration officials plus the port officials before we detect that they are carriers of the virus.
As I said, the immigration officers, they have been supplied with PPE, and when they question the passengers or the crew members, if they show signs or answer questions that may require they be put on to the port health officer, then they are referred to the port health officer who will do the necessary checks. And if need be, they will be refused entry if the port health officer finds that they are, or they will be quarantined and then thereafter probably refused entry.
And that goes for both Shagaramas, also for the CARICOM?
All ports, all ports.
Okay, Member Dionaran.
Thank you, Madam Chair. One question to the Ministry of Finance. Now, this is a worldwide problem that we are having right now, and we know that global supply chains are being affected. And Trinidad and Tobago is heavily reliant on the world economy for the level of imports. How has the Ministry of Finance been engaging with the business community to deal with that problem?
Okay. Madam Chair, through you, member, that information I do not have. I will have to get it at a higher level and then provide that to the committee at a later date. Also, if I may, you asked a question earlier, and I was able to get the information. It's 4.15%.
Could you elaborate, maybe, could you elaborate the process that you all would have gone through to select this particular financing from this particular agent? Because 4.5% sounds a little bit...
4.15?
4.15?
Yes.
Sounds a little bit on the higher end. What was the process that was used to decide on this agent for financing?
There is a division within the Ministry of Finance that negotiates all loans on behalf of government, as well as guaranteed loans, and there is a process that they have in place, documented process. So that I would probably have to provide that information for you, which is followed in treating with loans. So I would not be privy to the details of the discussions.
Okay, so Madam Chair, may I ask
If
for that
you,
in writing?
yes,
Yeah.
okay,
Thank
that
you.
will be provided.
I may have missed it earlier. Do we currently have any nationals under self-quarantine?
Yes, we do. Yes, we do. I don't have the exact numbers. I think I would have said about a week ago that we would have had 20-odd persons since the start of the quarantine. About a week ago, we would have had, of that, we would have 8 left. So I didn't get a recent update as to today or yesterday, but we would have had 8 of them in various stages of the quarantine.
Could you supply for us in writing the number left?
Sure.
And the end dates for each one?
Sure, yes, will do.
As it comes. Yes. Member Boudou?
Thank you, Madam Chair. CMO, I just wanted to take you back to that, the protocol that is being used for those coming from the UK, Canada, and the USA. You said those passengers are you're collecting information. Is there any reporting requirement from them to the authorities during, it's a 14-day period?
14-day period, yeah. So we will be doing active surveillance. So we're not asking them to report. We are calling them directly to get information on a daily or every few days we will call, because based on the exposure risk, If we think they are low risk, we will call every few days just to make sure that we pick up their symptoms if they have symptoms early and there's limited community spread.
I just wanted to follow up on Member Dana Ryan's question about the supply chain issue. Is there any issue at all with regards to supplies of other drugs and so on, with regards to the hospitals and so on?
So
I'm not talking about treatment particular for COVID,
Sure.
but whether the supply chain has been affected because of what's happening in
Well,
China.
I
and
think
India and so on.
China has produces a lot of the world's supply of medicines to start with, and they also produce the APIs, which is the active pharmaceutical ingredient, which a lot of other countries actually utilize to make drugs. So because of the issues in China, there is an expected delay in pharmaceuticals generally worldwide. We have been working very closely with NIPDEC to see which items are the ones that will be critical in the first instance. And of course, we have noted with concern that India has put sort of a restriction on items that are coming out of India as well. So we have put China and India as our two areas in terms of where we get drugs from. We have looked at those two areas to figure out basically what is our stock like of those items and if there's an alternative market. PAHO has been notified as well, and they are looking for alternative markets through the strategic fund. We have met with the chamber as well as all the members together with NIPDEC, with the suppliers, and we will meet with them on a, NIPDEC and ministry will meet with them on a one-on-one basis based on the drugs to go further in detail as to how they can source an alternative supply if we think something is at risk. So those discussions have been going on now for about 2 months, thereabouts.
Yeah, what about the Canadian market? Has there been any impact? I know we get some drugs.
As far as we know, not as yet. But I mean, because China, the Chinese and the Indian situation impacts all of us. There's an impact worldwide.
So we do have contingency measures in place. So.
Yeah.
Right. Can you give us any update at all on what's the latest with any possible vaccine, just for the information of the public? What's the official take and what's your impression?
But I mean, we're hearing a lot of things, but generally speaking, in terms of vaccine development, usually takes quite a number of years, especially when you have a novel virus like this. It is not going to be, I don't think, within this calendar year for sure, even if we do a rush trial, as was done for Ebola. Even if we do that, it will not be for quite a long time.
Just one other thing, the issue of gyms, both public and private gyms and so on. Have these owners been engaged, or is it part of the process?
So hopefully the start of the private sector engagement will begin when we meet with the chamber to discuss those things with regards to sanitization and what private sector can do. And I think the gyms are, as you said, is an area that you have a lot of hard surfaces, you have a lot of contact, so it's an area that needs to be sanitized very frequently to avoid. But I mean, as a matter of personal responsibility, you need to know the areas that you go. Of course, wash your hands as often as possible and try to avoid them if you are sick, of course.
Thank you.
Okay, are there any questions? Member Antoine.
In the response from Dr. Sonia Barker, she had indicated an input from Ms. Joy Brown, the occupational health nurse, but we didn't get it. Are you willing to come forward?
So she would have alluded to some of the methods that we would have adopted at the Port Authority. And she would have spoken to training as one. We also have a sanitization protocol that we're basically going to be rolling that out within the next few days, where we can have sanitization of all our hard surfaces, similarly to what is going on in Singapore right now, right? All within a realm of prevention, right? Because it's not just the COVID, but we would also have influenza, right? And the transmission of any viral type disease, yeah?
That be shared with, for instance, like going back to the water taxis who are not under the Port Authority. Would this protocol be shared with them so that they would?
Yeah, sure, we can share, Tim.
Might I ask if you could provide us with a copy of that protocol?
Yes.
Yes. Thank you, Member Dana Ryan.
Thank you, Chair. To the Ministry of Health or the CMOH, well, to CMOH, what would you say at this point, given this crisis that is taking place, and you being the person in charge of everything so far, most of the things so far? I commend you and the team for the good work that you all have been doing so far. But what would you say are the three main challenges that you have encountered in trying to make the situation easy for everyone to deal with?
Yeah, so in the early days, one, the data in terms of is a novel virus, right? So when you have a pathogen, the more you know about it, the better. So the research on the actual virus, the incubation period, who can spread it, how it is spread, is a challenge when you have a new virus. So that data, as we have seen spread in other countries, and the research is coming now, is more readily available. So the data on the disease itself and the way it is spread makes it difficult in the first instance. The biggest challenge, I mean, I don't know if I could give you three, right? But I could give you two. The biggest challenge we have had is the challenge of fake news in terms of getting I think, not only in Trinidad, across the world. So people posting things on social media and spreading rampantly. Even in mainstream media, we have had things being reported that are just untrue. And we have taken up a lot of time and resource trying to respond to them and debunk the myths. So I think fake news is another area. I think testing to some extent in the early days if you want to give you three, testing capacity was an issue because we would have had the capacity to test I believe in January or thereabouts, CAFA test for the entire region. So we would have waited on CAFA to set up their systems. And again, it goes back to the same point. It's a new virus, so the kits to actually set up the tests weren't available to them. So basically, those are the three challenges that we have had so far.
Thanks. In terms of maneuvering the challenge with fake news, now I know I followed the Ministry of Health on Facebook, and also I'm looking on the newspapers. And you all have been pretty active in trying to debunk the fake news. What a lot of persons seem to still be unclear of, because even today while browsing the newspapers, I saw a commentary that said that, yes, we know that we need to take preventative measures, sanitize, wash our hands, etc. But what are some of the symptoms that we should be looking out for? Is it just symptoms of the common cold? People are still asking these things. Could you, for the purpose of the listening public?
Yeah, so as we said, symptoms people can be asymptomatic, meaning they have no symptoms at all. There's a certain group that will have no symptoms. They can have mild illnesses, like a flu-like. So you won't be able to tell the difference between a common cold and this virus if you are a mild case. Once you get to the severe realm, you're looking at things like a dry cough, shortness of breath, labored breathing, that sort of thing, feeling unwell, generally unwell. So those are the signs and symptoms generally. Some people have acute diarrhea. You will have vomiting in the extreme cases related to other organ failure and that sort of thing. So but the common, the flu-like symptoms, which everybody knows basically what it can present exactly like that. So it's difficult to tell the difference between the two, between the common cold, the influenza, and COVID. It's very difficult, even for a trained professional. That's why we are saying to get to the health care facilities or call the healthcare facilities, make sure you speak with someone, you get a formal opinion as to whether you think you are a suspect case, and then we do the testing from there.
And I want to go back to one of the earlier questions Member Boodoo would have asked. And it was related to the person in Canada who indicated that they passed through Trinidad at some point. When you get all the information from about that individual in terms of the public health information and the epidemiology information, that plane, that person, that aircraft, that person would have traveled on, what is the protocol in terms of the area from where that person sat? Is it 4 rows from, we need to notify those persons, or is it that the entire aircraft persons has
It depends. The normal protocol with someone that has very mild symptoms is 2 rows in front and 2 rows behind and on the side as well. So generally 2 meters. If somebody has a an illness that causes vomiting or something on board, then of course we consider the airplane contaminated. So there's tiers of contamination. If somebody is asymptomatic, in this case, you would more than likely have, this person would not have had symptoms on board. So the containment, what we would be looking at is the 2-meter spread, 2 rows in front and behind.
Now, given that senior citizens tend to be a little more susceptible, and if they are also on the aircraft, wouldn't consideration also be given to notifying them as well?
The issue is we have to go with the protocols, and even when you look at the 2 rows in front and 2 rows behind, and the research we have done, I mean, the world has done a lot of research in terms of contamination on aircrafts. And when you follow those passengers up, you find that it's very, very negligible for somebody to pick up those kinds of diseases on an aircraft, meaning not aerosolized diseases, droplet spread. So I don't think it is a concern once you're not within that sort of catchment.
And CMO, one last question I want to ask. In terms of that same case in Canada and your major challenge that you have identified as fake news, in that particular case, the news is spreading through social media. And I think one headline today in the newspaper almost makes it seems that the case arose here. And I understand that there may be some delay from what you have said in getting all the information that you need. Is there a need, therefore, for the Ministry of Health to issue some sort of release that puts a certain amount of perspective on this case in light of the absence of full information? Because what hasn't really come out, and you said it, is that the medical officer of Alberta, in fact, indicated that she couldn't say where the contagion took place. But of course, we're not hearing that. What we're hearing is that one person who's a confirmed case in Alberta came from Trinidad and Tobago. How do we deal with that until you get all the information that you would want?
Well, I think it's difficult to anticipate the risk without having the information. And it's something we have to keep our eye on very closely. Look at the posts that are going on, see the reaction, and then make a determination. Because at this point, all we can say is that we have to rely on the information from Public Health Canada before we can say if there's any risk to the population at all. But as I said before, it is highly unlikely that there's any concern, that the only concern that the population could look at, of course, if the person was here, is where they would have contracted it, if they would have contracted it from Trinidad, which seems very unlikely because of the way the discussion is held. And again, there's too little information from what we have seen in the clip to determine anything at this point beyond being speculative. So I would hold for now until we get the information and then make a determination.
I keep hearing you saying it's very unlikely.
Yes.
And I'm not challenging that. What I really want to know is if maybe you can give me some of the factors that make you conclude very unlikely.
As I would have said, actually on the media this morning, the impression we're getting, and as I said, is lack of information. So all you know is that someone is COVID positive in Alberta. They would have visited Trinidad. I don't know when they would have visited Trinidad, when they would have been positive in terms of symptoms, if they would have had symptoms prior to that. What gives me a little confidence is that, generally speaking, if you are, especially now with COVID being as it is, and the increased vigilance in airlines, someone would not have been allowed to board our aircraft and go to Canada coming from any territory unless you were well, meaning they have no symptoms. So keeping that in the back of my mind, I generally, and the degree of spread without symptoms of any illness of this type is little to none. So it means that you would have had symptoms in Canada, presented for a test, and been tested there. So based on those facts, I think they're limited facts. I think there's hardly any risk of concern for Trinidad.
Because the information also says that coming out of Canada is based on travel history. Okay.
They said there was a history of travel to Trinidad, and the other cases would have been other territories as well. So Trinidad having no case at this point, the only way you can get any virus is if you have contact with someone that has the virus or has been exposed to the virus, an asymptomatic carrier. So that's the only way you can get it. So being able to spread as a country with no confirmed cases is very unlikely. You have to have community spread. Even if a large country has 5 cases and someone visits the country, it is not likely that you will pick up that virus from that particular country. We have no confirmed cases at this point. It's very unlikely that somebody will come here and pick it up and take it somewhere else.
And do you have any idea when you are likely to get a response to your email to Canada, save and accept the acknowledgement?
Well, we hope it is as soon as they have the information to share with us, which should be within a day or two.
Any other questions? Okay, so I'll take Dr. Bodo, and then I'll take Member Dionarine, and I know we can keep these officials here for the entire day, but this is a continuing conversation, and therefore, after these 2 questions, I'd like to close up the discussion.
Thank you, Madam Chair. Mine actually is just to say thank you for appearing this morning. I know you all have very busy schedules, and to give you the support and encouragement for the work that you're doing and for the work that you will continue to have to do over the next couple of months. Thank you.
But Dionarine.
Thank you. My last question to immigration. Now, is with respect to the thermal scanners. Now, I've read that you all have more thermal scanners at the airport now. Is that correct?
Remember, the thermal scanners are for public health, not public health, sorry, port health officers. They have these scanners, not immigration.
So yeah, so we have 5 handhelds and 2 fixed at the airport, which is the same cadre we would have had before.
Okay, so if the scanners detect someone with a temperature, a high temperature, so who runs along the person?
No, once you detect it, Port Health is the one that will do the scanning. So we will be immediately put on personal protective equipment and they will go to Port Health. They will be taken to Port Health. They won't be allowed to go to the normal immigration process. So there's 2 isolation rooms in the airport. They'll be taken to those rooms immediately with personal protective equipment.
But, you know, I saw a picture on the newspapers and it's this person standing at where you leave the aircraft, and it's a good few people that is leaving the aircraft. How do you track down that person after they leave and you detect the...
So you remember we have immigration, they have to get through immigration. So they're still not landed. So once we detect anything, and if someone is refusing, there's immigration, there's the security systems in the airport that will assist us. But generally speaking, once we get somebody with a temperature, they go straight to Port Health.
Okay, so thank you. I want to thank all the officials here, Ministry of Health, Ministry of Finance, Ministry of National Security, Port Authority, Airports Authority, Defense Force for coming and having this really interesting and enlightening conversation. I mean, COVID-19 is something that I think has the attention of many of our citizens of Trinidad and Tobago. As I said before, this is going to be a continuing conversation, and hopefully when we meet again, we'd be in a better position. We're in a good place, but in a better position than we are now, in that a few more weeks would have passed and we still would not have had a confirmed case. So I want to congratulate you all for the work that you all are doing right now, and I'm sure the resources are limited. The resources are never enough. I wish you all a continued successful day. I want to thank the media and the members of the listening public who stayed with us, who sent in questions to help enrich this conversation. I thank you. This meeting is now suspended.